In this video, I'm going to cover the biggest mistakes people make in trying to correct their low back pain and what they should do to correct it. Hi, my name is Dr. Rob Bates. I'm a chiropractor and a certified athletic trainer. And before you try any of these recommendations, make sure you check with your healthcare provider to make sure this is correct for you. The first mistake is you got to understand is that pain is subjective, that no one wants to have pain, is they want to get rid of that pain as soon as possible. They got to realize what pain is. It's really the body adapting. It's really just a warning signal. It's kind of like if you went in and you're driving at night and your oil light went off in your car and it's glaring up into your eyes and it's just irritating your eyes, and you just got to pull off the side of the road and you got to do something. You open up your glove box, you take out a spray paint can, you spray paint that light black and you can't see it anymore. Okay, go ahead and drive on. You corrected the symptom. That's exactly what people tend to do, is that they use things like anti-inflammatories or injections to take care of the symptom, to feel better while their body actually gets worse over time. The other thing is that they may do things what I call aspirin stretches. Aspirin stretches is something, I even do that, is to where you may find that one stretch that if you have that back pain, it helps alleviate enough to keep you on your way, and it's a quick little fix. But it's just removing the symptom while things actually get worse. Number two is sometimes we give up on ourselves way too soon on the things that we're trying to do to correct our spine, and we give into things that unnecessary medical procedures, for example, like invasive medical surgeries, which are irreversible. So it's important that we realize is that the body is self-healing, and we really just have to be patient and develop the discipline to put in the work necessary in order to get the results that we want. Number three is not understanding how the body actually heals. I have patients in the past to where they've gone to orthopedic surgeons and they've gotten consultations about their low back pain. They perform the MRI. The MRI shows a disc bulge or disc herniation, and the medical doctor says, I found your problem. I can correct that physical problem. We need to cut out that disc and you're going to feel better. And logically, it makes sense to where, oh, okay, there's this physical problem, remove it, and it'll take care of my problem. However, how your body actually heals is it has an immune response. It's an inflammatory response to where when you have that disc bulge, is that you have this immune system that can go in and actually reabsorb the disc over time. Reabsorb it to where it restores the function. Once again, it's self-healing, self-regulating mechanism that actually does that. Your body actually does that. The problem is if things can interfere with those processes. For example, anti-inflammatories and steroid injections. That interferes with the immune process, inflammatory response to absorb the disc. So understand, if we can remove interferences and allow the body self-healing mechanisms to work, that your body can actually heal those things that you normally thought couldn't heal. So what can you do about it? Number one, you can follow some of the recommendations of Dr. Stuart McGill, the spinal specialist. He says practice virtual surgery. It's a great idea, because imagine if you practice a virtual surgery to where you pretend like you had spine surgery. Of course you didn't, but you practice all the precautions post-surgery. So you're going to avoid all those daily activities, the lifting, the sitting, the things that are going to irritate your spine typically. And you practice that for about 6 weeks. Allows it to calm down, allows you to remove some of those daily activities, the interferences, to allow the body to start the repair process. Then if you do number two, you do functional stability type of exercises to start strengthening up the core around that spine. So you perform abdominal curl-ups, lateral planks, the bird dog, and you practice that for 6 weeks during that time. And the last thing is a structural rehabilitation, which most people don't even know about, is to restore the lumbar curve, the lordosis. The proper lordosis, science shows, should be anywhere from 35 to 40 degrees. Most people with back problems are going to be below 35 degrees, which puts abdominal stress on the discs and the joints of the spine, creating long-term chronic pain down the line. So if we can remove the interferences, take the proper rest from daily activities with through virtual surgery, like Dr. Stuart McGill says, then you practice spinal stabilization exercises along with restoring the proper lumbar curve. That's how you're going to allow the natural healing capabilities of the body to heal your back pain and actually make things better and make you great.